Hey, y'all, and thank you so much for tuning back into another segment here on GEMS podcast. With me is my special guest, Dr. Keegan Hadley. And here is a bit about Dr. Keegan. He is a doctor of occupational therapy, specializing in using psychological treatments such as acceptance and commitment therapy, known as ACT, with his patients. As a patient and therapist, he has a deep understanding of the interventions and knows how emotional stress can interfere with rehabilitation, daily activities, and overall quality of life. As an athlete, he tore both ACLs playing college and semi professional football. This experience made him acutely aware of the struggles associated psychologically post ACL injury and how to overcome them with positive results. So, without further ado, please welcome Dr. Keegan Hadley, where we're going to dive into psychological flexibility and recovering from trauma.
Thank you so much for letting me be here.
My pleasure, Dr. Keegan. And oh my gosh, whenever you popped on, I was like, man, he looks really young. But I may or may not ask your age. But before we dive into your subject matter expertise, I definitely want to give my audience a chance to connect with you on a personal level. And I'm sure you've done your research and listened to some segments. So I like to do that with either a fun rapid fire 10 question game or an icebreaker. What are you in the mood for?
Ooh, probably an icebreaker.
Okie dokie, here we go. We're breaking the ice with Dr. Hadley. So I want you to share something crazy that you have done in your life or a fun and interesting fact about yourself.
Hmm. I would say an interesting fact about myself is um, hmm, probably that I've played a college football game with a torn ACL.
Oh, wow. Did you know your ACL was torn playing that game?
Yes, 100% for sure new.
Interesting. I would say instead of interesting, that would kind of be crazy. So, did you exasperate the pain by playing with that torn ACL?
So essentially, it just kind of dives into my story almost. That was the first ACL I had, so that was my left one. And I tore it. If you're familiar with football, it was during fall camp of my junior year in college, and I rehabbed for roughly 6 weeks, and then put a brace on it, and then played in 3 or so games. So I definitely knew it was torn. Yeah.
Oh, wow. Okay. So now we're going to dive into your subject matter expertise, psychologically healing from trauma, using the ACT method, and just that flexibility. So, with you being a physician and doing some of the things that you're doing, did you always know that you wanted to go down the route of becoming a doctor?
I always knew I wanted to work within medicine. I wasn't really sure on which area. I mean, I kind of gravitated towards physical therapy or psychology just because of my background with mental illness. And then obviously with the two ACL tears, I spent a lot of time with physical therapists as well. So I kind of was going back and forth quite a bit between those two. And I was lucky enough to find occupational therapy. And it's just kind of the um, perfect marriage between the two, and I'm able to work with the different psychological or emotional issues one might have, as well as address the physical deficits as well.
Oh man, I needed this conversation like months ago because I was in the thick of it when my dad got paralyzed from the waist down due to medical negligence. So we had OT coming, we had PT, we had rehab, and I just really, really had high hopes that my dad was going to be able to walk. But had we known that he had a stroke that went undetected, we could have got him to a neuro center first before, going to a rehab where he ended up getting worse in rehab. The all places where you should rehabilitate somebody to somewhat, having that quality of life that they had prior to coming to rehab. But neither here or there, because he's in a better place, no longer suffering. I just wish that we could have done more. And I feel like sometimes when someone doesn't really know the intricates of the health system, plus on top of that, we had the pandemic going on back in May of 2020, which, it's still going on, but just seeing my dad from May to November and just the transition, how you walked into the hospital and then you're paralyzed from the waist down was just a freak show. So I thank people like you for what you do because it is not easy with OT or PT. And some patients are very combative and some patients are very open. But you mentioned something early on. You said with your um, physical ailments that you had with the 2 torn ACLs. And then you also mentioned mental health. And we are currently in Mental Health Awareness Month. So, did you experience mental health issues as well, or do you just have experience dealing with it with like patients?
No, the reason I was so interested and wanted to go into psychology or dealing with mental health issues is I've struggled with anxiety since I was a freshman in high school. So pretty severely all throughout high school and college, and a little after. I'm just now starting to really get quite a bit better. So it's been a long battle for sure.
And thank you for sharing that. And how can dealing with that and overall trauma affect you psychologically whenever you're going through the healing journey of trying to rehabilitate yourself? Because people don't know that, the brain talks to the body, like it's the brain, the body, and there's different neurotransmitters that go back and forth. And if something is a little off balance, then that could prolong your healing.
Mhm. Yeah. So essentially for me, it was um, when I got injured both times, I was very interested in mental health, but I never really practiced anything. I was just like a pretty strictly an athlete or football player. So I thought a lot of the, sports performance psychology type stuff was kind of ridiculous, unfortunately. And that hit me really hard because I never really developed any of the psychological skills or positive coping mechanisms to deal with it when I actually lost my sport, because I used those physical things as my coping mechanism. So when they're kind of taken away abruptly, it was pretty traumatic.
Wow. And that's so, so important that you said your coping mechanisms, because everyone has their coping mechanism and their vices. Some smoke cigarettes, some like to have sex, some are interested in pornography. Whatever your vice is, like whenever that is taken away, or even those social interactions, like we saw a lot of people during the pandemic, whenever the world was shut down and you couldn't go anywhere except your home, a lot of people began to suffer mentally, and it also caused them to have different injuries because they were trying to work out at home. Things were getting torn and pulled, and they couldn't necessarily go to certain places because they're like, oh, we could give you a telehealth visit. And I said, did I say I need a damn telehealth? I need a person face to face.
Yeah, it's definitely been a struggle with overall, especially primary healthcare, where they're, need to take like blood pressures and, those kinds of things where you have to physically be there. It's definitely struggled for sure.
Yeah, but one thing that you have accomplished in the thick of it is your new book, which came out in May 17th.
Hmm. Hmm.
Tom, overcoming the psychological challenges post ACL injury. So is Tom like your pseudonym or
No, it's actually torn. Like
oh,
tore my ACL. Yeah, no, it's not a big deal. Uh,
okay.
Torn is essentially the story of me as an athlete. It started in, I kind of started the story in high school and went through the different issues I had with anxiety, and then my struggle with the two ACL tears, and then afterward, and some other emotional trauma that I went through, and how I kind of got through that using ACT therapy. So, or ACT therapy principles.
So let's talk about ACT therapy principles because I have no idea what that is, and I'm sure the audience is probably wondering the same.
Mhm. So essentially, it's kind of third generation, like you've heard of CBT,
Yeah.
cognitive behavioral therapy. So essentially, the what you're trying to get out of CBT is, if I'm having the thought, I'll use my personal kind of negative thought was, I am broken. That was kind of my thing, whether it was, physically or just due to my anxiety. I always felt like, I had the persistent thought, I am broken. So CBT would essentially say, whenever you think that, you're supposed to replace it with a positive thought, like, you think about your favorite location or your favorite food or whatever the case may be, and just think positive thoughts, and it essentially posits that you can control your thoughts, and that always was a big struggle for me. So after I tore my second ACL, I was in a pretty dark place. I ended up getting in a relationship with an individual who I would find out was an alcoholic, and had quite a bit of a emotionally abusive situations due to that relationship. And after that, I knew I needed some help and a way to deal with that, so I started going to therapy, and that's when I came across CBT, and I just struggled because I could not change my thoughts. I'm one of those kind of people that, if you say, hey, look over there, or don't look over there, my brain will it'll go over there and stay over there. And I couldn't grasp it. So I kind of scoured the internet, and I found ACT therapy. And the subtle difference between CBT and ACT therapy is, when I have my persistent thought that I still have to this day, I am broken. It just allows me to gain a little bit of space and perspective on that thought. So instead of thinking I am broken, I can adjust that to thinking I am having thoughts of, feeling broken, or I am having feelings that I am broken. It just allows you to separate that. It's that slight change that just allows you to realize that you are not your thoughts and you can't control your thoughts. So.
Yeah, so it's amazing how one tweak and one shift in your paradigm can reprogram your body's operating system to really get you to think about things from a holistic perspective, but also to fly on all levels. Because if you are operating in a zone of pessimistic and that negativity, you're not going to be able to receive the good that is trying to enter into your life, whether it's relationships or whether it's your nutrition or your overall wellness as a whole, because there is a disconnect. So I like to tell some of my coaching clients is, if you think about a cell phone, we all have our cell phone. There's certain times, whether you're using an Android or a Apple, that it's going to tell you to update, and you need to update that software in order for your device to function optimally. So if we take time to really analyze how we update our softwares on our electronic devices, why can't we update the softwares in our body to really help mind, body, and soul? And then whenever you feel like you're at a point where you just can't do it, find a therapist or someone that you trust that you could confide in. And I always say a paid professional that is trained, because sometimes your family members and your friends, they can have those unconscious biases. And sometimes what they say, yeah, it may be beneficial, but it's not going to help you unclog the sink and really get things flowing again.
Yep, I would definitely agree. A lot of the people I speak with are people who have had injuries, and it's just a very unique situation where you have generally athletes who have an injury like an Achilles injury or an ACL injury, where they're out of, what they love, kind of taking them out of their self-identity, or, their main source of self-esteem, and just being able to cope with that. So I can certainly understand that for sure.
And I did have another question. Dr. Hadley. So with the ACT method, oh, well, the ACT principles, what does the A, the C, and the T stand for?
Acceptance and commitment therapy or
Okay.
training, depending on how you're operating. Yeah.
Thank you for sharing that. So acceptance, commitment, and then the T could be therapy or training. And
Mhm.
then if you pair that with CBT, cognitive behavioral therapy, you're
Mhm.
on your way to golden.
Yep. Yeah. Yeah. Like I said, I don't, well, I use some things that are kind of loosely related to CBT. I don't delve as far that way as just because I personally, I don't believe in using anything that hasn't worked for me. So because I have a hard time, like I can't sell anything I don't believe in or not believe in, but it didn't work for me. I have a really hard time with that. So I incorporate some of it because CBT is essentially like the father almost of ACT because it was around before and has a lot of literature to it. But there's just some nuanced differences that allow ACT to be more flexible, hence the psychological flexibility. And it's just an easier way for me to operate with my clients for sure.
So outside of those two, the ACT therapy and the CBT, are there any other natural modalities that you use that helped you with your psychological flexibility, whether it was acupuncture or it was any other form of natural remedies that people introduce? Some people are now saying hypnosis is beneficial, or tapping into your chakras or your Reiki.
Mhm.
And some people feel like, I'm not about that woo woo, but sometimes it can be beneficial.
Yeah, I mean, I haven't really dived into um, any of that stuff. I kind of just stay, in my lane. I suppose that because I don't have much knowledge on any of that other stuff, I just kind of stay within ACT. It's what I'm very comfortable with, and it's very fluid and flexible, and I'm able to help, a very diverse population with it. So it's kind of just where I stay.
And how long have you been practicing
um, a year and a half.
in the medical field?
Hmm. Yep.
Okay. Oh, wow. So you're like really new at it.
Hmm. Yep. Yep. Yep.
Okay.
Rather new. My professors were all excited slash almost confused that I was writing a book because it's almost from I was learning about some of this stuff as I was almost more interested, unfortunately, in some of the stuff I was learning outside of class, which was ACT rather than inside class. So I was kind of learning in tandem. So
So do you ever foresee yourself adding on anything new to your practice?
um, yes, but it would actually be more on the physical side of things, just the different joint injuries and stuff like that, because it's my opinion that a lot of the exercise science is like 20-ish years behind what it really should be as far as joint injuries. So,
Okay, super cool there. And then I know you have quite a bit of initials behind your name. So let's talk about those different accolades. OTD is that occupational therapy or doctorate in occupational therapy.
yep.
Okay. And then the other OTR/L.
So that's just occupational therapist registered and then licensed. So,
Oh, okay.
yeah.
And then this is a big question here.
Mhm.
So, since we're now in the space where doctors are in a virtual setting, are you only licensed and able to practice in your home base, or where can you practice? Because there may be someone watching and say, "Ooh, I need Dr. Hadley," or
Mhm.
for anyone watching, they may be like, "Oh my gosh, he's like Dr. Dreamy or whatnot. I need to slide in his DMs and see if he can work on me."
Mhm. So it's a little nuance. That's a really good question, and I had to really dig. A lot of what you learn in school, they don't teach you some of this stuff. So essentially, for occupational therapists, I can provide therapy in state, but it would be. This is why I made the distinction between ACT training and ACT therapy. They're essentially the same in practice. But just the terminology and some of the semantics are a little bit different. But I can coach anyone, throughout the country or wherever. But as far as being able to call myself, I'm providing therapy, that has to be in North Dakota. That's where I'm licensed and registered. And there's no like psychology, unlike psychology, we don't have like a reciprocity where if I have a North Dakota license, I can, see patients in Minnesota and South Dakota and Montana. It doesn't unfortunately work like that. You have to go through like a decently tedious process for each state, which is frustrating. So.
Oh, wow. So that is definitely interesting because I have seen it where people could kind of
Mhm.
dip and dab in multiple spaces, which definitely helps their business flourish. So I thought that was a good question to ask.
No, certainly. Yeah.
And out of our conversation, is there anything that I did not ask that you want to say to the audience regarding the work that you're doing?
Um, yeah, I would say it's applicable to, even if maybe you haven't even had an injury, but you're struggling maybe with um, just how to deal with it all. The world's really chaotic right now, as everyone knows. And if you're having, trouble balancing between maybe schoolwork and your sport, or even is a a working professional and family and all the obligations we have, I kind of I work with the whole gambit as far as just helping them cultivate the 6 different ACT skills. So.
Well, I thank you for adding that value there. And then this is going to be more so a personal question, not for me, but I'm just asking for my husband because he's had a torn ACL. And
Mhm.
by doing something crazy as riding the dirt bike, and I told him, don't go out riding the dirt bike whenever it gets late at night because where we live, there's different deers and coyotes that come off in the back of the trails. So
Mhm.
he flipped off the dirt bike. Him and a deer collided, and my husband flipped off. And so he tore his ACL. And when he told me, I kind of like chuckled and laughed because I was like, oh, dude, you're fine. Like, and then when I went back outside, I was like, are you seriously not about to help me get the groceries out the car? And then I really analyzed him from head to toe. And I saw that his pants were ripped and he was all kind of like jacked. And I was like, oh, something did happen. So he went the route of doing PRP. So, like the stem cells
Mhm. Mhm.
injection to like kind of help repair the ACL. So
Yeah.
have you done that or know anyone else that has?
No, but I would have. I'd love to actually talk with him because I do a blog also on joint injuries, mental health, and stuff like that as well. And I'd love to just get his insight on how it's worked and what his experience was, because it was something I would have loved to take advantage of. I've had 4 surgeries personally. I had surgery for each leg, obviously for the ACL surgery, and then a revision surgery. And if I could go back, I am not 100% sure I would have had surgery. So I'd love to just get his insight, for my clients as well. So.
Okay, yeah. So I'm definitely going to share this segment with him and share because they did tell him surgery, but then as he was doing his research, he found that you could do the PRP where they extract the blood, twist it all up, and then put it back in. And I was like, "Are you sure, dude?" But then the crazy thing was, insurance is not like gung ho on that stem cells right
Mhm.
now and doing that. So we literally paid out of pocket, and I'm like, "Are you flipping kidding me? If you would have just got off the damn dirt bike and but I learned you don't kick a man when a man is down and you just support your boo, whatever your partner is doing, you support them because he
D-
lived to see another day.
Well, I'm glad he made it through that. Does he still have the motorcycle? Is that that's a question here.
Yeah, he still has a dirt bike. He still rides it or whatnot. And I tell people I'd rather him have the dirt bike than the motorcycle because the deal was we were going to go there and buy a go-kart, and then he's like, oh, let's get dirt bikes. So we were, instead of leaving with one, we were going to leave with two, but they didn't have an automatic one for me to ride, and I can't ride the manual, and I'm like that type of girl that loves to do the guy stuff. So I was like,
Mhm.
okay, fine, we'll just get one dirt bike. And I'm so glad I didn't try to get on that thing because I probably would have bust my ass too, but Neither.
It was the same way. Last time I was on a motorcycle, I was probably like under 10. I don't know when. And I, for whatever reason, couldn't figure out where the brakes was. And I ran into my own garage. So that was my last experience with a motorcycle. So I'm on the same playing field as you for sure.
Amazing. And now let's jump into the call to action, Dr. Hadley. So, what is it that you would like to leave the audience with as far as your call to action? You could plug your book. If you have your book near you, flash it up so we can see what the cover looks like.
I wish I did. I ordered it as soon as actually some of my clients have gotten my book before me, but mine got back ordered for some reason. So I don't even have a copy of my own book, but you can connect with me. I'm very active on social media, Instagram and Twitter at the ACL Therapist. And then my personal website is the acltherapist.com or keeganhadley.com. I'd love to hear from you if you're having any issues. So.
And there you have it, listeners and viewers. Dr. Keegan Hadley, all the way from North Dakota. He can only give therapy in North Dakota now, but he can train you state to state. So keep that in mind. And until we chat next time, don't forget to like, comment, and subscribe. We're on 40 plus platforms. You can also see all things video and see this doctor by going to our YouTube channel, which is at Gems with Genesis Amaris Kemp. And lastly, but not least, I want to thank each one of you for tuning in on a regular and consistent basis. Because of you, our ranking has bumped up to the top 2% globally out of 2.8 million podcasts for www.listennotes.com. So get at us. Let us know what topics you want to hear next so I could continue to bring on amazing guests such as Dr. Hadley. Until next time, peace, love, and lots of blessings. Have a good one, y'all.